Hey there, I'm wearing a face mask so you understand that today's topic is coronavirus or COVID-19. If you are interested in knowing or in learning some new words, continue watching the video. Okay, so let's start. Coronavirus. Okay, so there are many words to learn today. So I'll be giving you some new vocabulary. I'll be giving you the symptoms of the coronavirus and I'll be speaking about prevention. Okay, so let's start. Here's some words which are very important. Word number one is outbreak. So you've got outbreak, you've got epidemic, and you've got pandemic. Outbreak means the beginning, the start of the virus. The outbreak of the coronavirus was in Wuhan, okay, in China. It means the beginning, okay, of the disease. It was there. Great. The outbreak of the coronavirus in the United States, okay, was in Washington, D.C. The outbreak of the coronavirus in Tunisia was in the capital, in Tunis. It means the beginning. After that, now after the outbreak, it starts, the virus starts, or the disease starts to spread, okay, to spread to different areas. So here we will be speaking about epidemic. So epidemic happens when the disease spreads, okay, in different places. Okay, nice. So now if this disease spreads now all over the world, okay, in many countries, we will not speak about epidemic, we will speak about pandemic. So outbreak, epidemic, pandemic. Okay, nice. Next word, it is covidien, and this is a newly coined word. What do I mean by covidien? Covidien. A covidien is someone who is not aware of public maybe health, of security measures. He doesn't care at all. Is someone who doesn't take protection measures into consideration. Example, a covidien is somebody who is sick maybe, or who is not sick and who tries to hug everybody that he sees, okay? So he doesn't respect maybe, distancing, okay? And he doesn't know about this. So he is a covidien, okay? Brilliant. Next one, screening. What do I mean by screening? Screening, okay, means testing people for the presence of a disease. So when you test people, okay, for the presence of a disease, we call this screening. And screening happens when, it first happens when, especially when taking the temperature of somebody in order to, to check whether he tests positive or negative, okay? And especially this happens for the, the newcomers, okay? Those who come for the first time maybe, in a country. So they just, go through screening, okay? In order to check whether they test positive or they test negative. Okay, brilliant. Next one. So test positive or test negative. So when you take this test, okay, so either you test positive, and when you test positive, this is something bad, okay, it means that you have the virus, okay, you have the COVID-19, but when you test negative, this means it's okay, so you are healthy, okay, nice, and I hope that all of you, test negative, okay, great. Next one. Carry, the virus or have the virus. I may say that Jack has the virus or Jack carries the virus, okay? Jack doesn't have the virus, okay? Great. So please, avoid, going with the Jane because the Jane has the virus or the Jane doesn't have the virus, okay? Nice. Next one. Super spreader, okay? What do I mean by super spreader? A super spreader is somebody who infects many people at the same time. He is a super spreader here. It means he makes the virus spread very quickly. Okay? So a super spreader, he is infected and he mingles with people, okay? He mingles with people and he infects them. So we call him a super spreader, okay? Causing maybe the infection of many people at the same time. Nice. Next one. In quarantine. If somebody is in quarantine, it means he is likely to have, the coronavirus, and he is staying in quarantine in order not to have contact with healthy people, in order not to infect them. Okay, so we say in quarantine, to be in quarantine. Okay, so where is Jack? No, Jack is sick. He is in quarantine because he has the coronavirus. Extraordinary. Next one, flatten the curve. So you know that there is a curve, okay? That, I mean, you know, each country now, reaches, maybe when it reaches a peak, it starts, I mean, to drop. But there is also, okay, now something about the curve when it is, okay, flattened, okay, when it is a flat, okay, this is something good. It means what? Maybe the number of dead people, okay, is the same, and the number of infected people is the same, okay, you know, during maybe a month or during 2 months, okay, it's the same. So if it is same here, we flatten the curve. So when we flatten the curve, it means that we are secure. Nice. Next one, protect the vulnerable. Okay, who are the vulnerable? The vulnerable, okay, you know, are old people. Because old people are very sick, you know, and they are very weak, okay, and they cannot, they are open to many diseases, okay, so they are the vulnerable, okay. How do we protect them? By not going, by not visiting them, okay, you know, during this period, okay, we keep them safe, okay, in their places, okay, fine. Next one, stock up in groceries. You know, I mean, when we stock up on groceries, it means, okay, you know, we go to supermarkets, okay, or to malls, and we try to pile groceries, okay, to pile pasta, to pile couscous, to pile maybe milk, okay, to pile tomatoes, okay, potatoes, everything. You pile everything. This is, you stock up here. You stock up, okay, in groceries, okay, stock up in groceries. It means a large quantity, okay, you buy a large quantity, okay, and to take it at home, or to be taken at home, okay, nice. Next one, to hoard. To hoard, okay, so when you hoard, it means what? It means that you buy great quantities of something and you keep it. Why do you keep it? You keep it maybe in order to sell it another time. And when you sell it another time, maybe the price will be higher, so, and you sell it, okay. If you do this, you are called a hoarder. And nowadays in Tunisia, okay, many people are hoarding what? They are hoarding semolina, and they are hoarding flour. They've got, you know, much semolina, much flour, okay, they are keeping them in warehouses, okay, in places, okay, and in order to sell them another time, okay, with a very high price. So this is something illegal, and of course, okay, anyone who does this will be punished, okay, severely, okay. Nice. Let me now move on to the symptoms, okay. I say symptoms and not symptoms. I say symptoms. What are the symptoms of the coronavirus? What are the symptoms of having COVID-19? Let's see. First of all, fever. Okay, the person will have, I mean, fever, okay, you know, nice. Next one, coughing. He will keep coughing, and especially this dry cough. This cough without phlegm, okay, it's a dry cough, okay, nice. Another symptom is shortness of breath. It means, okay, you know, I speak about breath difficulties, okay. This is shortness of breath. It means, okay, the person is not able to get oxygen, okay, you know, to his lungs easily. Nice. Next one, tightness in the chest. I mean, he feels that he's the chest. This is the chest, by the way. He feels or she feels that the chest, I mean, is very tight, okay, to the point that he will not be able to breathe, okay. It's tight here, and tight is the opposite of loose, okay. Brilliant. Body sneezing, okay. Okay, sneezing. This is when you just, you know, blow, okay, you know, like this, okay, you know, you sneeze, okay, you sneeze, okay. So when you keep, I mean, sneezing, and it's a symptom now. When you keep sneezing, this is not a good sign, okay. When you've got fever, coughing, shortness of breath, tightness in the chest, and you sneeze, this is not a very good sign, okay. Nice. Next one, body aches. You feel that your joints, okay, you've got a problem with your joints, maybe, okay, you are not able to move. All your body aches, okay, and this is a very bad sign also. Another one, you feel fatigued, okay, so feeling fatigued, tired, worn out, knackered, exhausted, okay, weary, all in, you are not able to move, okay, you don't feel active at all. So this is another symptom. So in English we say to develop symptoms or to exhibit symptoms. So when you develop the following symptoms or you exhibit the following symptoms, don't hesitate, okay, you know, to contact a doctor in order to make sure that you are fine, okay. Brilliant. Now, so let me move to the last part, which is, okay, you know, prevention, okay, how to prevent ourselves. So because, okay, in English we say prevention is better than a cure. So how can we prevent ourselves, okay, and avoid having this COVID-19? Nice. First of all, we are supposed to hunker down. What do I mean by to hunker down? Hunker down means stay in a given place for a long time, mainly for protection. Okay, So maybe, okay, Jack, calls you, or Emmanuel, I don't know, okay, he asks you to go and play football. Say, no, please, sorry, I'm hunkering down. You hunker down for, okay, for protection, for your own, okay, safety. Nice. Next one, lockdown. If I say, okay, that the city is on lockdown or under lockdown or in lockdown, okay, three prepositions here, it means, okay, that everything is shut, maybe, okay, no shops, nothing at all, and all the people are at home. So I am on lockdown, it means I am at home, okay, for security reasons, okay, nice. So this is lockdown. Next one, you are supposed when you cough, okay, you cough. Cough, okay, or sneeze, okay, into a tissue. A tissue, okay, I use it to blow my nose, okay, when my nose is stuffy, especially in winter, I use a tissue to blow my nose. So I'm supposed here to cough and sneeze, okay, where? Into a tissue, so I need a tissue, nice. Or cough and sneeze into bend of elbow. If you don't have a tissue, you see, this is your elbow, okay, this is the elbow, this is the bend of the elbow. So I sneeze here, or I cough here in order to avoid the contamination, okay, or the infection of the other, okay, nice. Next one, use hand sanitizer, okay, a face mask. So this is a face mask, okay, by the way, and I showed you this in the beginning. So this is a face mask, okay, and the sanitizer, this is a sanitizer, okay. The sanitizer is a kind of a liquid, okay, that I use in order to protect myself. So this is what I call, sanitizer. So I just, rub my hands, okay, in order to protect myself, okay, nice. So I use a face mask, I use sanitizer, okay, hand sanitizer, and I use soap, okay, and this is soap, by the way, my friends, okay, here is soap, okay, and in English we say a cake of soap. A cake of soap. Why soap? In order to wash your hands, okay, from time to time, maybe 3 times a day, 4 times a day, 5 times a day, in order, okay, to avoid having, okay, this COVID-19, okay? So, my friend, the last thing I may say is prevention. Prevention is better than cure. So, okay, stay safe, stay strong, stay positive, okay? And I hope that, things will be better, and I'm sure that things will be very, very, okay, will be much better, okay, in the, very soon. So, stay positive. Thank you so much for watching. If you liked my video, give it a rating, subscribe to my channel, and hit that click button in order to get my latest. Thanks a lot, and have a lovely day. Goodbye.